Health and media messaging focuses a lot on aerobic exercise as being a crucial lifestyle behavior to improve health and reduce the risk of death. And therefore promote things like cycling and running and walking. However, we cannot forget about strength training. And for people who are over 65, this is particularly important in order to maintain their health, reduce mortality, maintain their physical function, and maintain independence. So in this video, I'm going to review 5 key points that you need to know about reducing the risk of death in people who are over 65 by implementing a resistance training or weight training program every week. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York City. I specialize in arthroscopic surgery and sports medicine. As people age, there is a gradual loss of muscle strength and muscle mass. And there seems to be a peak of muscle mass and strength to about the 3rd decade. And then after that, there's about a 3 to 8% loss per decade. And after someone hits 60, that loss starts to accelerate. Now, it is thought that this deterioration is really coming from disuse. Maybe people as they get older just aren't as active, maybe they have injuries or arthritis or things like that that are keeping them from being active. So there's more thought that is probably mostly coming from disuse as opposed to just aging. Now, the statistics seem to corroborate this as studies show that only 20% of older people meet the activity guidelines of doing strength training twice a week. Now, out of those 80% of people, older people who are not doing the recommended guidelines, 90% of them are doing no strength exercise at all. Only 10% are doing a little bit, but 90% are doing absolutely no strength training. So how significant is the reduction in mortality by adding strength training to your weekly routine? And so there was a meta-analysis of 16 studies that pooled 263,000 people. And what they found is that those who were doing the recommended guideline, at least 2 times a week of exercise, strength training I'm talking about, could reduce their risk of mortality by 15% compared to those who were not doing that amount of strength training. So these researchers broke down the different causes of death to see how doing strength training would impact and reduce the risk of those causes of death. So to start with, cardiovascular disease-related death was reduced 17% by doing at least 2 times a week of strength training. The incidence and death related to cancer could be reduced by 13 to 19%, depending on the study that is looked at. And the risk of developing diabetes has been shown to be reduced by almost 17% by doing at least 2 times a week of strength training. If you're over 65 years old, how many days per week should you be doing strength exercises? There was a study that looked at over 100,000 people, and they broke people up into 2 groups. Those who were meeting the recommended guidelines of aerobic exercise, that's at least 150 minutes, and also people who are doing less than that, less than 150 minutes of aerobic exercise. So 2 groups of older people. Those people who are doing the recommended guidelines of aerobic exercise, if they were doing at least 1 day of strength exercises a week, they could further reduce their risk of mortality by almost 25%. Now, if they were doing 2 to 3 days per week of strength exercises, they could reduce their risk of mortality by 35%. And if they were doing strength training 4 to 6 times per week, they could reduce their risk of death by almost 42%. And for those older people who are doing less than 150 minutes a week of aerobic exercise, so they were not meeting guidelines. So if they added 1 day of strength training, they could reduce their risk of mortality by about 17 extra percent. If they were doing 2 to 3 days per week of strength training, they could reduce their risk of mortality by 23%. And if they were doing 4 to 6 days per week, they could reduce their mortality risk by almost 30%. So you can see here that if you're meeting aerobic guidelines and you add more and more days of strength training, you get even better results, meaning reducing your risk of mortality the most. But for those people who are doing less than the 150 minutes a week of aerobic exercise, adding strength training also help reduce the risk of mortality, just not as much as if you were meeting both guidelines. So we just finished talking about how many days per week someone should do strength training. Now the question is, what are the benefits of doing just strength training or just doing aerobic training or doing a combination? So it's clear from the studies that if you combine both aerobic and strength training, you get the best benefit to help reduce the risk of dying. Okay, so what these studies have found, and we're talking about people who are over 65, is that if they are only doing strength exercise and they're doing it 2 to 3 days per week, but are doing no aerobic activity, they can still reduce their risk of mortality by 10% compared to people who do absolutely no activity. Now they looked at people over 65 who only do aerobic activity and they're meeting that 150 minutes per week, but they're doing no strength exercise. They can reduce their risk of mortality by almost 25% compared to people doing no activity. But those people who are over 65 that are both doing the 150 minutes per week of aerobic activity plus 2 to 3 days per week of strength training, they have the greatest benefit and they can reduce their risk of mortality by almost 35% compared to people who are not active. Now, people over the age of 85 also benefit from adding strength training. And so studies have looked at just this group of people, and they found that those who are over 85 and only doing aerobic activity but meeting the 150-minute guideline, they can reduce their risk by almost 20% mortality risk compared to people who are completely inactive. But those people over 85 that do both the 150 minutes per week of aerobic activity plus the 2 to 3 times per week of strength exercise, they can further reduce their risk of mortality to almost 30% compared to people who are completely inactive in their age group. One of the barriers I come across when I talk to older people about doing strength training is their concern that they're too old to be able to build strength, too old to build muscle mass, and because of their age, they're worried that they're going to get hurt. However, science disputes these myths as just being untrue, and there have been multiple meta-analyses that have looked at people in this age group and show that they can, in fact, increase their strength by 20 to 35%, and they can see these gains in as little as 6 to 9 weeks. For example, one meta-analysis of 1,000 older adults with an average age of 67, they were able to find a 29% strength gain in leg press, 24% gain in chest press, a 33% gain in knee extension, and 25% gain in lat pull down. And so these gains were seen in both men and women, and these were older people. Several of these meta-analyses, although they show that strength dramatically improves, muscle mass gains lag behind. So don't be concerned if you don't see yourself bulking up really big. The strength typically will come, and we think this has to do with more neural adaptation as opposed to fully bulking up. Are there specific characteristics of a strength training program that are important for older people? And so here again, meta-analysis help us. And the key here is that higher intensity strength training will help greater gains in muscle strength. So what does this mean? So there are ways that we can look at this. For example, one way to measure it is what's called the 1 rep max. And what that means is, let's say you go to the gym and you go to do the leg press machine. What is the most amount of weight you can do? Let's say for this case, it's 100 pounds. So that would be your 1 rep max. That's the most you can push on the leg press. So then looking at intensity, you will have light, mild, moderate, and high intensity. So light intensity, less than 60%. Mild, somewhere between 60 and 70. Moderate, between 70 and 80. And high intensity, above 80%. Now your strength training program should be progressive. What does that mean? That means that after a few weeks of doing your exercises, your strength is going to improve. So now you can go back and check, what is your 1 rep max? So it'll probably have increased. And so if that increases, then when you're doing, let's say, high intensity, 80%, so the actual weight that you're using is going to go up as well. And this is called progressive. Every few weeks, you want to see if you can increase the weight if your 1 rep max has gone up. So far, we've discussed a couple of aspects of the program. How many times per week should you do it? So that's frequency. We've talked about intensity. And now let's talk about some of the other parts of the program, right? So that might be how many sets, how many reps, how much time under tension, how much time of rest between sets. So all these components, there are recommendations for people who are older. There's a meta-analysis that looked at people over the age of 65 to figure out what of these metrics is the most ideal to maximize strength gains. And here's what they found. Doing 2 to 3 sets of whatever exercise it is, let's say chest press or leg press, and then assuming someone's exercising at an intensity of moderate to high intensity, so that's let's say somewhere between 70 and 80% of your 1 rep max, you should be able to do somewhere about like 7 to 9 reps. Okay, now while you're doing the exercise, it should be about 6 seconds of tension. So you can imagine, let's say 1, 2, 3, 4, 5, 6. Okay, and then in between each one of those reps, maybe about 4 seconds of rest in between each. Now, when you finish one of your sets, waiting about 60 seconds in between each set is also recommended. So all these have been looked at studies, and this seems to be the most ideal plan in order to maximize strength in people who are over 65. Now, this might be different for people who are younger, but this is a meta-analysis that has been done in people who are over 65. The second barrier I see for older people doing exercise is many of them have musculoskeletal problems. For example, some studies show that over 40% of people above the age of 65 have some arthritis. And the most common locations are hip, hand, knee, and you can imagine that that can interfere with people's ability to exercise. And the studies show that that's true. People who have arthritis seem to exercise less. The good news is that there are multiple studies, including meta-analyses of people with arthritis, that show that doing resistance training, weight training, can reduce pain, improve function, and is often well tolerated. There are studies of patients with arthritis that do show that up to 10% can have some increased types of pain. They're usually not serious. They're like muscle strains or some slight increase of pain from the arthritis. Now, very often people can just do trial and error, see which exercises aggravate them and stay away from them, and find other strength exercises that are well tolerated. Another thing that people can do is sometimes work with like a physical therapist or a personal trainer to help guide them through this. Why does doing resistance training, weight training, reduce the risk of mortality in older people? Is it because of doing the exercises, or is it because of building up the strength? And it's probably some combination of both. However, it seems that building up the strength is really a critical component. And there was a study of a few thousand older adults, and they broke them up into seeing how strong they were and how much resistance training they were doing. And they found that the people who were weak, but were meeting the resistance training exercises, meaning doing it 2 to 3 times per week, did have a slight reduction in their mortality risk. And for that group of older people that were both strong and were doing at least 2 to 3 times per week of strength training, they had the best. They were reducing their risk of mortality by 70% compared to those people who were both weak and not doing any strength training. So you can see that having more strength is really critical component. So it's important that when people are designing their strength program to make sure that the intensity is enough to actually build strength. As in many aspects of medicine, not everybody responds to treatment the same way. And the same thing is here with strength training. Some people who are lifting weights are going to improve their strength. Other people, not as much. However, the good news is that many people who are doing strength training, even if they don't build up strength, still seem to have the benefits of reducing their risk of mortality. And why is this? So when someone does resistance training, studies have shown that it can improve both glucose and lipid metabolism. It can also improve insulin sensitivity. It can improve blood pressure. It can improve the immune system. All of these factors that it improves all improve the risk of mortality. So we think that by doing strength resistant training, even if it doesn't build strength, because of all these other mechanisms, will also impact and reduce the risk of death. Let's wrap up this video with a few key takeaway points. Number one, adding a resistant training weight training program to your weekly exercises will reduce your risk of mortality in older people. Number two, combining both aerobic activity and strength activity will further reduce the risk of mortality in people over 65. Number three, the myth that older people cannot build strength or cannot build muscle mass is untrue. Number four, the myth that people with arthritis cannot exercise is untrue, and conversely, actually has been shown to improve their symptoms. And number five, let's talk about the actual protocol. So, try to do strength training 2 to 3 times per week. Try to do it at a higher intensity. And in terms of the specifics, try to do 2 to 3 sets for each muscle activity, like chest press, leg press. Try to do between 7 and 9 reps in between each one, and try to do it under a tension of about 6 seconds for each one of those reps. And then in between your sets, take about a 60-second break. If you found this video helpful, please click the like button below and subscribe. Thank you for watching the video. I look forward to seeing you in my next video or in my office.